Why is chordoma bone tumor surgery so complex? Imagine trying to remove a tumor that is nestled deep inside a maze of vital nerves, blood vessels, and bones. That's exactly what surgeons face when treating a chordoma. These tumors develop along the central skeleton, often at the base of the skull, the spine, or the sacrum. Because of their location, they grow in areas packed with critical structures that control movement, sensation, and organ function. This makes surgical removal incredibly challenging. The main goal is to remove the tumor completely in one piece, a procedure called en-bloc resection. This approach helps prevent the tumor from coming back. But achieving this is not simple. The tumor can span multiple spinal levels or involve complex parts of the skull base or pelvis. Surgeons need to plan carefully, often working with teams from different specialties like neurosurgery, orthopedic oncology, vascular surgery, and plastic surgery. Each team helps manage different parts of the operation, from removing the tumor to reconstructing the area afterward. One big challenge is the tumor's proximity to the spinal cord, nerve roots, and major blood vessels. Damage to these can cause serious problems like paralysis, loss of bladder or bowel control, or bleeding. Surgeons must be very precise to avoid harming these structures. After removing the tumor, the area often needs reconstruction. This might involve placing metal cages, bone grafts, or muscle flaps to restore stability and function. Another difficulty is that chordomas are resistant to chemotherapy and only respond modestly to radiation therapy. This makes surgery the main treatment option. Because of their rarity, many surgeons and hospitals have limited experience with these tumors. That's why specialized centers with multidisciplinary teams are best equipped to handle these complex surgeries. Patients often face risks of complications after surgery, such as wound healing problems, infections, or fractures, especially in surgeries involving the sacrum. Since the tumor's location can affect mobility, bladder, or bowel control, surgeons must carefully weigh the benefits of removing as much tumor as possible against the potential impact on quality of life. Preoperative counseling and a team approach are essential. In summary, the complexity of chordoma surgery comes from the tumor's invasive growth in critical areas, the need for complete removal, the involvement of many surgical specialties, and the high risk of complications. This complexity highlights the importance of treatment at specialized centers, where experienced teams can work together to achieve the best possible outcomes for both cancer control and patient function. Always remember to consult healthcare professionals for personalized advice and care.